There is some positive new data for the Johnson & Johnson COVID vaccine. According to a study of nearly 480,000 healthcare workers out of South Africa, the single...
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
Single dose shot is up to 71% effective at protecting against severe illness and hospitalization from the Delta variant. It was also found to be 96% effective at preventing death. So joining us now to discuss this study is the founder of Gramercy Pediatrics in New York City, Dr. Dyan Hes. Hey, doctor, very glad to have you here again. This news about the J&J shot might be a bit confusing for some people. A previous study suggested that the vaccine did not offer as strong protection against the Delta variant, at least as strong as the other shots. So what's different about the South Africa study?
So the difference is the South Africa study is actually in people who received the vaccine, whereas the previous study was actually just done in a laboratory on blood cells. So it is much more promising, and it's really exciting to know that we have some reassurance that the Johnson & Johnson vaccine is actually offering protection to these patients, and they shouldn't be worried that they got the wrong vaccine. I think it's just sad that we had so many pauses in the Johnson & Johnson rollout, because I think it's quite safe.
So, Doctor, the American Academy of Pediatrics found nearly 94,000 kids tested positive for COVID-19 in the last week. Let me just say that number again, 94,000 kids. That's a 143% increase from just 2 weeks ago. Are we to understand that the spike is driven by the more contagious Delta variant? And is the strain also causing more severe illness in kids that we did not see with the initial, I don't know if they call it the alpha or the beta variant, but what we had back in March of last year?
So right now it seems it's too soon to tell if it's more virulent. It's definitely more contagious. And remember, about 70% of people in America have gotten one vaccination. So where is the virus going to go? It's going to go into the unvaccinated. It's mutating. So the vaccine is going to affect children who are unvaccinated. So they're getting many more cases. So we're seeing many more cases, more hospitalizations, and we don't know if the more hospitalizations are because it's more virulent or just because there's so many thousand new cases and that the hospitals are getting inundated, especially in these areas where there's low vaccination rate. I think Florida, because there's many tourists as well, these hospitals are getting slammed, but the data is out yet to see if it's more virulent. The only time will tell.
So kids are back in school, and often what happens when kids are interacting with each other, they pick up all kinds of things. Maybe not so much now that there are some sort of, different sort of protocol in place because of COVID, but how can parents tell the difference between the common cold and COVID?
It's impossible. That's the problem. So some kids have COVID so lightly and they don't even know. And COVID can present like anything like the flu. It can be a sore throat, runny nose, rash, red eyes. So really all we do all day is we test for COVID, and it's just what it is right now until we have a better way, until there's like nonstop screening in schools, like free COVID testing in schools, maybe 2 or 3 times a week. Every time a kid is going to be sick, they're going to have to be tested for COVID. Now, my bigger concern is that about the exposure. So let's say somebody's positive in school. Now there's no more online school. You get sent home for 10 days. If your classmate is positive, you have 10 days that your parents have to take off and teach you. So I'm really worried about these because it is spreading so wildly. All these kids are going to be sent home from school all the time. And I think we're going to have to change some of these regulations about sending people home for 10 days.
And doctor, as kids head back to the classroom, as you know, some states will require masks while others have banned mask mandates. And some health experts claim that forcing children to wear masks could have a negative impact on their development. What's your take on that? First of all, is that accurate that asking a child to wear a mask could have some effect on how they develop? And what is the alternative?
So, all along I've been saying I feel that masks hinder children's development, but then again, they're actually in school. So is it better to not be in school because COVID is going to be rampant without masks? So you have to choose your risk-benefit ratio. I do believe that definitely wearing masks. Kids are not going to understand facial expressions, and there might be some speech delay, but I still think it's better to be in school with masks than to be at home. That being said, all masks are not created equally, and I really think they should be wearing paper surgical masks or even like N95s. I mean, they're very expensive, and I actually think there's something we totally forgot. I think masks should be subsidized by the government. You're telling people, don't reuse masks, give your kids a mask. You know, you can't get into Italy with a cloth mask. You have to be wearing a paper mask when you go through customs. But here, everybody's wearing these cloth masks, and they don't prevent COVID the same way that a paper mask does. And I really think that masks are expensive, and I think they should be subsidized.
So the White House has been turning to social media, encouraging young people to encourage young people rather to be vaccinated. They're paying influencers to create pro-vaccine content in the hopes of swaying their followers. What's your take on this strategy? I don't know how much of an impact it would have on kids, because kids obviously are also depending on their parents to be interested in getting the shot. But what's your take?
Exactly. I mean, I think that, you know, there are very few children who would say to their parents, I want to get the vaccine and you're not letting me. Those are the rare ones. Usually kids mimic what their parents say. So if their parents are anti-vax, they tell all their friends about how bad the vaccine is. And if their parents are pro-vax, you know, I have 4-year-olds saying, I can't wait to get the COVID vaccine, because they hear what their parents say. And, but I don't think it's bad, right? I don't think it's bad. I think anything positive about COVID vaccines is good. I think information, you know, trying to counter misinformation is super important. And remember, in 1956, Elvis got his polio vaccine live on the on the Ed Sullivan show. So, public influence does change policy sometimes. But let's see. I think maybe more influencers with the adults, especially because we don't have a vaccine for under age 12 yet. I think that's what we have to put pressure on. We need the vaccine for the children so they can get back to school. We need to speed up this process of FDA approval as well.
Dr. Dyan Hes, always great to have you. Thank you very much. Appreciate it.
Thank you.